Johnny mentioned that I got involved with this program thanks to Steve Nuttall. Part of the reason I'm here today is because I ask way too many questions. So I said to Steve, when he was lamenting on about health insurance and the rates going up for his small businesses, I stupidly asked, well, and he told me about this law. I asked, stupidly, why not? I said, okay. And he looked at me and he smiled and he says, well, there's too many business people and economists say it can't be done. It's not sustainable. I said, okay. And I asked another question. You see a pattern forming here. I asked why again. And he goes into the political ramifications and the regulatory matters and the fact that this really has to have a lot of people to work. I said, okay, so why hasn't anyone done it? And before he would answer that question, he challenged me. He says, you're so smart, you figure out how to do it. So I said, okay. I sat down, I read the law. I started talking to the insurance companies, because really it's a team effort. I talked to the small business owners. I discovered what their problems were. I found out that it's not only about the rate increases and the high costs. Some of them are sitting here in December and discovering and sitting on their hands waiting to find out, my rate's going up 20%? Are they going up 40%? Are they going up 80%? Now, I have run a very small business for a little time, and I have watched Steve and Johnny and others run theirs. You can't plan for growth if you don't know what your costs are. So part of the problem is not only the high cost of health insurance, it's the unpredictable nature of health insurance. And it's the gray hair that I see given to so many health insurance agents around the state, as they sit there and they can't figure out why some of these health insurance rates keep going up. So I'm here today to tell you and ask you a couple of questions. What if I were able to tell you that we could solve the health insurance problem in our state while we solve the economic problems of our state? What if I told you we could give small businesses access to the same kind of health insurance that Fortune 500 companies have access to at the same rate levels? And what if I told you we could do it all without spending a dime of your tax dollars or my tax dollars? When I told Steve this and I asked him these questions, he gave a hearty belly laugh and said, how on earth are you going to do this? And so I said, it's going to take a lot of hard work. It's going to take a lot of effort by a lot of people. But it took examining the problem first. And a very wise man once told me, when studying a problem, don't look at the facts, look at the reality. And so I started going to the small businesses with different insurance agents all across the state, talking to them, learning their problems. And what I found was there's some good things about healthcare in the state, and there's some bad things. The good. Medicine in America is amazing. We have synthetic tissues, we can transplant organs, if you can't find a transplant, we can give you an artificial organ and we can replace joints. Biotechnology is on the rise and it's one of the fastest growing industries in America. It's innovative and it's new. That's the good. Bad, the business of healthcare is failing, and it's failing miserably. It's stagnant, there's no open market competition, and there's no innovation. When I looked at the problem, the thing that stuck out at me was from the time your doctor orders a test or an x-ray, to the time you and your insurance company pays that bill, it takes 13 people on average to process that kind of claim. I'm sitting here going, I can go online today to Craigslist or eBay or any of these great websites. I can buy a house. I can buy a car. I can buy a trip across the world, fully automated, and it doesn't require one person. But it takes 13 people to pay my bill? That's inefficiency, and that's where we have to start. So problem number one, we have to get the healthcare providers in the room with the patients, the small business owners, the people paying the bills, and the insurers, and figure out what can we do to cut out the paperwork? What can we do to streamline this process? And you know what? I'm not opposed to saying, okay, if there's some ways that everybody agrees that, okay, this is required by law, we need to approach the legislature about streamlining this process, about using technology and the internet to help us while protecting privacy. Problem number one, we can fix that with technology and collaboration. Problem number two, like I said, The healthcare industry is stagnant. Health insurance hasn't changed in decades. New firms in health insurance, that's unheard of. So here we are, and we're here, and we're innovating. And we're going to start by grouping everyone together in large groups so they have the same benefits that large corporations have, and we're going to structure their plans long term. So we can ease the pain and worry in December or in your renewal months about whether your rates are going to go up 20%, 40%, 50% just because you lost 2 employees or you hired someone with a medical problem. Small businesses should not be penalized for wanting to hire good people. And they should not be penalized for ever-changing costs in healthcare. So that's problem number 2. We can fix that one too. Problem number 3, this one really we can fix, is in America, we are all incredible shoppers. I learned this from my mother and my sister at a very early age. My mom and my sister can go to a retail store and pay $75 for a shirt. Why on earth would they do that, though, when they can go down the street to the strip mall and get the exact same shirt for $40? Or I promise you, one of you, probably my friends Lane and Casey, since they buy everything online, could go online today and buy the shirt at Amazon or Overstock.com for $20. That's open market competition. That doesn't exist in healthcare. One of the eye-opening experiences I had was I learned about a procedure. You need procedure X, and you can either go to hospital A or hospital B. Now, hospital A has done 2 of these procedures, and they tell you the cost is going to be around $250,000. Or you can go to hospital B, where they've done 300 of these procedures. Guess what the costs are? $150,000. My word. And people don't have this information at their fingertips. So why would anybody go to hospital A, who's less experienced and more expensive? Why don't people know about this? Why can't they go to a website? Why don't they have the tools to find this information out? We can fix that too. It's going to take time, it's going to take education of the consumer, but we can fix that. And all of this is aimed at driving down the costs. If we help the healthcare providers cut costs, they bill less, which means less on your insurance, which means less premiums to pay for the small business owners. If we rearrange health insurance and structure it on a long-term basis and across a lot of people, we can spread the risk around. And finally, if we do educate the consumer and help them lower their healthcare costs, I don't care about it. Your health is your health is your health. I'm from South Carolina. I love my fried foods. And I will eat them all day long. I don't care how many wellness programs you throw at me. But if I do need health care, I need to know how to find it. I need to know how to look for quality and price. So back to my questions, because I have a lot of them. What if we could pioneer a whole new approach to healthcare? And what if we could do it with small business owners leading the way? Because Lord knows I've seen them stretch a dollar, and they're good at it. And what if we did it all, and we built a blueprint for how it should be done everywhere? And finally, and what if these business owners said to you, we've selected one of the youngest healthcare executives in America to lead our new approach to healthcare? All these questions got answered a couple of weeks ago. With help from the Department of Insurance, the legislators, the governor's office, the lieutenant governor's office, many, many lawyers. Yanni, I love you to death. But there are some lawyers that I just really wish we didn't have to hire. But they were help. And the small business owners themselves, we are here. The what-ifs have become a reality. And we're going to change healthcare. And we're going to do it one small business at a time, one employee at a time, and one family at a time. Now, thank you for listening and not laughing too much, because I am not a public speaker. But I have to say thank you to a lot of people. Mr. Price, when I showed up here today, this place looks fantastic. And we're going to try to help you in return. We really appreciate you hosting us. Our team, with over 130 years of combined insurance experience behind them. I don't know why they listen to me sometimes, but they do. And they are willing to work with somebody as crazy as I am. So I appreciate it. Governor Mark Sanford and the Lieutenant Governor and all the legislators and the regulators. It takes a lot to look at someone a lot younger than you and say, we can and see not just the person, but what they're talking about. Because I don't want people to see me, I want them to see what we're doing, because we are doing good for the small businesses of South Carolina. So I say thank you to them. It takes very big people to do that. Thank you. Mr. Michael Bales and Ms. Buchanan for taking time out of their schedule today to come down here. Really appreciate it. They're from the Department of Insurance. They're great people, and we've worked with them for a long time. My family, they have been very understanding and very patient with me over these past few years. And at last, and most importantly, the small business owners who were willing to let me sit with them and speak with them about their problems. We wouldn't be here today without them. So thank you. Thank you all for coming.